There are a number of job titles that fit under the umbrella term of clinical nurse educator, and that can be confusing for some people. I probably think there's about 120 job titles in all honesty. You could be a clinical educator, a clinical nurse facilitator, practice development nurse. You may be based on one ward developing staff in your area. Again, that could be all people who have a learning remit. Or you might be based in a corporate team or practice development team where you might have a ward as your base, but you spend 2 or 3 days in your corporate team. And some areas just have teams where they cover the whole trust. So it's really varied. If you just want to be based on one ward or in one directorate, it's worth investigating that. My role is I'm responsible for the in-house development of nursing staff, healthcare support workers and student nurses who are placed in the trust. It's not so much the academic pathways, it's more do they have the clinical skills and do they have the knowledge to deliver excellent patient care. When I first qualified, I had a meeting with a career development nurse and she told me to develop a secondary interest, like a sub-interest. And that was easy for me because I really always enjoyed teaching and learning. So my first role was on a GI vascular surgery ward, but I loved teaching and learning and I thought I'd develop that side of things. So I was a mentor to student nurses, supported newly qualified nurses. And then my career progressed. So I moved to London, I worked in renal nursing, also in GI nursing as well. And at the same time, I supported junior staff, I developed teaching boards, teaching resources. I went to America for 4 years as a nurse. And when I came back, I got a job at the Royal Brompton Hospital. And I got promoted to senior staff nurse. And then I got a 2-day-a-week secondment in nursing development, which was great because then I had an opportunity to really realise my love of teaching and learning. So I ran study days. I also worked clinical shifts with nurses as well, working day to day at the bedside with them, developing clinical skills. At the time, we then increased our capacity for student nurses, and I was required to lead on that development. So my hours increased. And then I got promoted a couple of times and I became full-time where I started leading on far more things such as healthcare support workers and delivering a lot more of a development programme across the 2 hospitals that are in our trust. When I first qualified, I did an in-house mentorship course. It was an interest I had from the very outset. I did a course in research, I did a module in leadership and also a CPD course in cardiothoracic nursing and a number of other ones relevant to the speciality at the time. I did a further education, adult education course. And then the best thing of all was my master's in clinical education, which I absolutely loved. It gave me the confidence and really got me to critically analyse my role as a nurse educator. For my dissertation, I evaluated the role of the clinical nurse educator, really diverse role. And my result of my dissertation was I formed a UK clinical nurse educator network. It's really important for nurse educators to have an accredited teaching course under their belt, something like in a PG DIP or a master's. Because just because you can do it in clinical practice, you might be able to do your job well, it doesn't mean that you can teach it well. It's not just good enough to work with somebody on a ward and say, I've worked with them for a day. You've got to understand what makes learning happen. As a nurse educator, you really need to have expert knowledge in what you're teaching to give you that confidence, that underpinning knowledge. My day could be teaching anything from the care certificate for healthcare support workers, teaching clinical skills for overseas nurses, teaching skills such as IV therapy, cardiac monitoring. But also I could be teaching on an academic module as well, for example, research on our master's pathway or advanced anatomy and physiology. Also, it might be electrolytes on a critical care module. I'm running mentor updates and professional updates too, so there might be something around the code or a new clinical guideline is being developed and I need to bring that into the trust. Some study days I am running regularly, but each time it's different because no set of learners are the same. You may have more senior members of staff who need to learn a bit more, so you've always got to prepare. So another part of my day is preparing for what is coming my way. Things can change very quickly in nursing. Nothing worse than standing there and teaching something when someone says, oh, actually, that doesn't happen anymore. Because I have a senior role, I also go outside the trust and represent education at various forums. So that might be maybe an initiative that the NMC are rolling out, also meeting with our university partners because of the students we support and making sure that we're working in a good partnership together. No 2 days are ever the same. It's not repetitive, there's always differences. That's what I enjoy about my job because it's so varied. The most important thing for me is the patient is at the heart of everything I do. I'm developing nurses, I'm educating them, but what are we in the job to do? We're there to ensure that the patient gets the best evidence-based care as much as possible. What I bring to the role is a really strong belief in the role of the clinical nurse educator. Their role is fundamental to the recruitment, development and retention of nurses, and that's really important. It's important to be grounded. There's nothing worse than not understanding what it's like on the front line. You need to understand what the nurses are experiencing, because in education you can't do things to them, you do it with them. I'm part of a team. I'm not an island. I can't do my job without the team that I work in. I can't do my job without the support of the staff I work with. I also have to communicate to different levels as well, from senior nurse and matron and director of nursing, right down to a healthcare support worker, and I need to be aware of all their needs and how they fit together. As a nurse educator, you need to stay ahead of the game and you need to look at what's coming your way. So you need to look at if there's any new clinical guidelines, if there's a change in policy, keep abreast of what's happening in the workforce and NMC standards. You're not just teaching for the current, you're teaching for the future. For me, what gets me out of bed every day is seeing that someone has learnt something. And that's what I say to people who want to become a clinical nurse educator. What gets you out of bed in the morning? If it's seeing that learning has taken place, that patients are getting great care as a result of that, then that's the right way to go.